Assalamu alaikum wa rahmatullahi wa barakatuh. Esteemed viewer, once again, welcome to MTA, a program, Health Check, your most famous one that helps you, guide you in as far as your health conditions or status is concerned. Today, we're going to discuss about the cancer or the eye cancer that affects the children. And today's topic of discussion is retinoblastoma. As usual, we get specialists regarding certain ailments, and today I have an eye specialist from Mbale. That's around 300 kilometers from the capital Kampala. So he's come to help us understand what is retinoblastoma. Yes. You're most welcome, Dr. Herbert. Before I go to the doctor that I brought to help us understand the topic of discussion today, which is retinoblastoma, we need to go to the public, and one of my colleagues is on the streets of Kampala. We need to see the awareness of the public regarding this medical issue and how it's affecting the people in the area where they reside.
Hello, dear viewers. This is Shafiq from Kampala, and I'm here to talk about a disease known as retinoblastoma. From my understanding, retino simply means the retina, and this is the light-sensing part found at the back of the human eye. Blastoma simply means the type of cancer that is mostly found in children, and it is caused by the precursor cells. This is aligned with the light-sensing cells, and I'm concerned because I tried to research about the signs and symptoms, and one of my friends tends to be in line with the signs and symptoms. The signs and symptoms include red eyes, painful, watery eyes, and then poor vision that is connected to the poor light concentration by the retina. Many cases have been reported, and it is observed that out of 4 cases, this disease is only got in one of the eye, and that accounts to 1 out of 4, where the victim is found to be having the cancer in both eyes.
Okay, thank you so much, my brother. That is the information in as far as the awareness of the public is concerned. And to you now, Dr. Herbert. I'm glad to have you again. Thanks for honoring our invitation once again.
Thank you.
The first question,
yes, sir.
Regarding the topic of discussion today. It's a new term.
Yes.
And it's my first time. It's coming to my know that there's even cancer of the eyes.
Yes, indeed.
I didn't know that.
Yes.
You're going to explain to us what is retinoblastoma.
Yes.
Yes, please.
Thank you very much once again for having me. And straight away to the question, retinoblastoma is one of the common eye cancers that affects children. And it is an intraocular tumor, which means it is inside the eye.
Okay.
And starts from inside the eye at the part called the retina. Yeah, so this cancer is malignant. Malignant meaning that it is one of those cancers that can spread or invade other tissues of the eye.
Okay.
But not only the eye, it can also cross to other tissues of the body around it. Yeah, so retinoblastoma is a cancer that is malignant, that starts from the retinal cells and spreads to the surrounding tissues around the eye and beyond as it metastasizes. Yeah.
Having understood what retinoblastoma is,
yes, sir.
Now we need to know what causes it.
Yes. Now, this is a cancer, like we had said, that starts from the retina, from the young cells of the retina. Yeah, so the most common cause or risk factor that can cause this cancer is hereditary. Most people inherit, people who are affected by this cancer inherit a gene, a defective gene,
okay,
that will cause them to have these cells multiplying at an abnormal rate and cause them a retinal cancer, which we call retinoblastoma. Yeah. So the other fewer cases are the ones which are not hereditary, but the most common one is a hereditary case.
Okay.
Yes, sir.
And doctor, before we go any further,
yes,
the cause now we know.
Yes.
And the term retinoblastoma we now know already it's the cancer in the eyes of the young ones.
Yes.
Now what, who is at risk
Who is at a risk of getting this cancer?
this cancer?
Well, like I said earlier, there's an inheritance of a gene, a defective gene from parents that they could give to their children and they get this cancer. Yeah, so the most common risk factor who is at a risk is a person who has inherited this kind of gene from their parents.
From their parents.
Or from their close relatives.
So like you said, it's more of genetic thing.
Yeah, so it's more of genetical.
Okay.
Yeah. And then the fewer cases are those that are not hereditary, but it's also common in people of Asian race.
Okay.
Yes. So when you're an Asian, you're at a higher risk of getting this cancer of the eye.
Okay.
That's right.
Now, another question is, how is it affecting the people in our society?
Yes.
How does it come about to affect the people of our society?
Yes, the prevalence of this condition is quite high. Every child that is born, a live birth of every child, a child, 1 in 15,000
Yes.
are likely to be affected by the condition, or 1 to 20,000. So that is a range. So every 20,000 live births, you could get one with the retinoblastoma. Yeah, so we have seen many such cases in this country of retinoblastoma, and there's development of technology on handling the condition that is rising.
Okay.
But indeed, it is a risk. It is a bad condition because it can cause death. Being a cancer that is malignant, it can spread to other tissues around the eye and also go to the brain,
Okay.
which can easily cause death.
Now, doctor, another question is about the symptoms.
Yes.
How does one know that their children is affected by this cancer?
Very, very important question. Now, the first thing that a person would know or would likely cause them to think that this could be an eye cancer, which we are talking about as retinoblastoma, there's an abnormal reflex from the child's eye. When you shine a torch or under low light intensity, especially in the darkness, you'll find that this eye is shining. That eye that is affected will be shining in an abnormal way. Okay. For example, if you've ever seen a cat's eye in the night, if you're driving and you flashed on a dog or a cat at night, you see how their eyes shine?
Yes.
Yes. So in human beings, this is not normal. Yes. But you'll find that that baby or that child's eyes are shining in that kind of way.
Seriously?
So it could affect one eye or both eyes. Yes, so you'd see that abnormal shining reflex from the child's eyes. You could suspect that this could be a cancer of the eyes.
Okay.
And immediately, the most important thing to do now is to take the child to a doctor. Yes.
Assuming that I perceive that my son or daughter
Yes.
has a clear vision, that's an assumption.
Yes.
Is there any need for me to go to a doctor to check or to diagnose whether my child is suffering from this cancer or not?
Yes, so still elaborating more on the symptoms, we will find that the affected eye will have a defective vision. The child will not be able to see very clearly with that eye, or even there will be no vision in that eye that is affected. Some other times you'll find that the eye has involuntary movements. It is shaking, it is moving involuntarily. So that is not a normal thing.
Okay.
Other times you'll find that the eye is misaligned. You find
Seriously?
what we call a squint. It is facing on another side when the better eye is...
Someone is facing you,
Yes, but the
yet
eye...
he's focused on a certain object.
That's right. So the eye is misaligned, then it has involuntary movements, it has that abnormal reflex, shining reflex, and then it has defective vision as well. So those are some of the symptoms that you might look at and say, surely this child could be having a problem and I need to take them to the doctor.
Okay.
Yes.
Having seen all those symptoms,
Yes.
At what stage do you think that, no, this is critical, you need to immediately go and see a doctor, having seen the symptoms?
Yes, for this kind of cancer, like we earlier described it being malignant, which means that it can easily invade tissues that are near it, inside the eye and outside the eye. So at the first moment that you recognize any abnormal thing, like I've just described in the baby's eye, it is very, very important that you take the child to the doctor for management. Otherwise, this cancer is malignant and can spread very fast to the neighboring tissues of the eye and also beyond the eye. And when it does that, that means even its management becomes more complicated. So the first time you see it is the best time you take the child to the hospital.
So the first time I see any symptom, it's already late?
Yeah, it can be. It can be late or it can be early. That will be determined by the doctors.
I don't have to hesitate.
But you don't have to hesitate and say, I think we can wait for some months or a year or a week. No. The moment
let me wait until I get money.
No. Take the child to the hospital.
Yes.
Yes.
How regularly should one go and for a checkup to see whether they have this cancer or not? How would I usually think?
And also, generally speaking, every one of us needs to have an eye check at least once every year, a very comprehensive eye checkup.
Seriously?
At least once every year. It is very important because some of the conditions that affect eyes, they will not cause you any pain or itching, but they will affect your eyes slowly, gradually, but progressively.
Oh.
Yes.
They are serious, slowly.
Yes, yeah. Killing
slow
you
but
slowly.
sure.
Slow but surely killing you. So unless you have an eye checkup, you might not know that you have a problem.
That a certain ailment is attacking me.
Yes, so it is very, very important that each one of us has an eye checkup at least once every year.
I have one of my doctors, a friend of mine.
Yes.
He comes to this show, this talk show most of the times when I invite him, and very soon I might have him. He tells me normally whenever he comes here that prevention is better than cure. We all know that.
That's right.
And he says that prevention is cheaper and cure is expensive.
That's right.
But in Africa, we take it to be the other way around.
Yes, that's
we
right.
most of the times wait until when the disease or an ailment gets to a critical condition, and we think of doctors and the best medications that you might think of. So
that's very right, and it's a huge problem you are facing in the health sector of this country. That people, or maybe us, especially men, we have very poor health-seeking behavior.
Yes.
A person has to be critically ill before they can go to the hospital.
Yes.
Otherwise, they can live with their headache for a month or two, and they're okay, taking some painkillers and go back to work.
After all, I'm not down. Why do I bother myself going to a hospital?
Which is a very, very dangerous way of handling certain problems.
Okay.
Yeah, so we need to respond as early as possible to any ailment that you might be having.
There I have a question.
Yes, sir.
Since you agree with me, or with one of our colleagues, a doctor still, that prevention is better than cure.
That's right.
What is the best way one can prevent themselves from attracting this kind of cancers?
Yes. Now, this cancer can, like we said, it can happen because you inherited a gene.
Okay.
So after that, there's nothing much that you might do to prevent. However, a very, 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 very quick response when you notice any symptom is very, very important in how the child will recover from the cancer.
Okay.
Very, very important. So it is very, very crucial that we get health check or get our eyes tested or checked very, very often, such that we don't have to wait for the condition to be at its worst stage before we report to the hospital.
Okay.
Yeah.
And I think to the mothers, you know, there are antenatal visits that they need to do most of the times.
Yes.
You are well aware that genetically you have such and such a disease, so you need to prepare for it before it comes.
That's right.
And
some of the things that they do in antenatal care is actually to screen for such complications.
Exactly.
And the problem also we are facing that few mothers still go for the antenatal. Others only report when they get the labor pains.
And actually,
which is very
the
dangerous.
problem is another problem is not only to the mothers but to the gentlemen as well.
Yes.
They think these antenatal visits are only for the women.
That's right.
Yet genetically, it might be you, the father, that is having this problem, not the
Yes,
mother.
that's right.
And the mother goes to the normally the dates that he's been
Allocated. Yeah.
allocated, and the report is that you do not have any
Yes, it is true. And
genetic problems regarding this kind of disease.
that's why we need such very many shows to happen, such that we can sensitize the masses.
Exactly.
That even as you are a man, you need to go for the antenatal visit with your wife.
With your wife, yes.
And be screened as well. Because some of the infections actually, which could affect the baby while they're still in the womb, it could be the man carrying them and infects the wife or the mother of the child. So it's very important for the men, especially the first visit of antenatal. You should go with your wife to the hospital for
the good
screening.
thing they are all watching, our viewer. That is as per the advice from our doctor, an eye specialist from Mbale. You need to go for antenatal checkups, both the mother and the father, and you'll be in the know in case there happens to come the bad news that you might have a son or daughter that will have a genetic transfer of this illness from either father or mother to your daughter or son. You prepare yourselves as early as possible. Dr. Herbert,
Yes, sir.
we need to conclude our program, but before we do, there's something you need to answer before we call this program to an end.
Yes.
Another question is quite worrying. It's an assumption.
Okay.
Let's assume a mother, a father, most especially a mother, you know, they are traumatized most when they see their children not as normal as the other ones are.
Yes.
Or the other kids are. They are traumatized to the extent that most of them throw them away. Most of them dump the responsibilities to look after them.
Yeah.
So what advice would you give to a parent that has given birth to a child already with this type of cancer? What advice would you give them?
Yeah, thank you very much for that question. And it is a very, very important one. And our viewers should know that this cancer can be cured. Very, very, very important to know. It can be cured and the child can be cancer-free. Actually, most of the cases that have undergone treatment have cured from this cancer. And the child will continue with their normal life. Sometimes the part of the treatment is to remove that eye to save the child.
Okay.
Yeah. Sometimes the child will go through a series of chemotherapy and radiotherapy, and actually they will recover and they will become like other normal children. So even while the eye has been removed, there are implants, prosthetic eyes, artificial eyes that can be put. One that exactly looks like this other eye that is normal. And the child, no one will know.
But is it functioning in a normal way?
It is not functioning, it is not seeing, but cosmetically the child will appear normal.
So the eye is just virtual, should I say?
Yeah, it's just an artificial eye for cosmetic purposes, so that the child can look as normal as other children. So as you, the mother or the father, you need to be very, very supportive to this child to help them to grow through the stigma that they might face, and also to help them to nurture them to grow to know that they are normal and they are okay, though one eye does not see or one eye has a complication or a problem. Yeah, so mothers, fathers, we have a very big part to play in this child's life. As from the beginning to the end, you have to be with them, such that they grow up as normal children, just like others. So otherwise, it will be very bad and you'll be the one to blame if the child does not thrive like others are doing, because you neglected them.
You neglected them.
Yes.
Doctor, you know, time has never been a good ally with us,
That's
but there are some facts from the audience that we had earlier.
Yes.
We heard what our audience or people from the streets know, understand as this cancer is.
Yes.
And I would like to thank one of my colleagues who has been doing this great task of moving around to see the views of our viewers. It is to this effect that we bring you, doctors, to give more hints and highlight on certain problems or ailments affecting our people.
That's right.
Before I call the program to a close,
Yes, sir.
what would be your concluding remarks?
Yes, so my concluding remarks would be first to thank you for viewing, and then it is important to have knowledge. Very, very important. So if you cannot get knowledge in any way, consult the nearby health facility that you have around you. They will give you advice. We have a problem that most people will go for traditional eye medicines, and then they'll complicate the things the more. But it is very better to go to a recognized eye health facility, have the child checked, and also not only the children, but even as the parents, we have to improve our health-seeking behaviors such that we can, just like you said, prevention is better than cure. It will be less, it will be very cheap for you to handle the condition in its early stages than to handle it when it is late. Yeah.
Okay, thank you so much, Dr. Herbert.
Thank you very much.
Thanks for traveling 300 and more kilometers all the way from Bali to Kampala to have a word of wisdom with our viewers. I can't thank you enough. And
Thank you
please
for
always
having me.
honor our invitation wherever you see our call. Please just honor the invitation and come and help our viewer. For today's episode, I won't be going any further except promising you that we still have more of these episodes of Health Check coming. And I promise that regarding the eye issues or eye problems, I'll still come back with my brother, Dr. Herbert, to come and help us understand or solve the eye problems that we have. But for today, this is what time could allow us, only 30 minutes for a program that is interesting as you've just watched, but unfortunately can't go beyond this. I remain your host, Nambale Bashir, and until we meet in the next episodes, Assalamu alaikum wa rahmatullahi wa barakatuh.